Hey, it's Kristina Shea, and welcome to the Kristina Shea Show. AI meets ambition and impact, powered by Women Up. Let's talk about the future of work, leadership, and society itself, because AI isn't just changing tools, it's changing power. So the question is, are you leading it or watching it happen? And if this sparks something in you, lean in. You're part of the conversation now. Welcome back to the Kristina Shea Show, where AI meets ambition and impact. Today's guest lives at the intersection of leadership, compassion, and AI-driven innovation, creating real impact in our communities. Today, I'm joined by Paul Sharman, a longtime serving city councillor in Burlington, and he's also deputy mayor responsible for strategy and city budgets, helping guide the financial future of one of Canada's fastest growing communities. But Paul's work doesn't stop at City Hall. His most personal and powerful mission was born from caring for his own mother, and it led him to create PACE Canada. PACE is reimagining how we care for older adults, bringing healthcare, wellness, social connection, and technology together so seniors can stay healthier, happier, and living at home longer, while dramatically reducing strain on hospitals and long-term care. It's preventative, it's human first. It's already transforming communities across Ontario. Paul is proving that when you combine leadership, heart, and connection, you change more than systems, you change lives. Paul, welcome to the Kristina Shea Show. And I also understand that you are a previous owner, former owner of a software development company.
Oh my goodness. Well, thank you for having me on the show, Kristina. It's a great pleasure to have this honor of being with you. And also just recognizing your own background in innovation and technology. I'm sure we have lots and lots of things to talk about because, as you point out, yes, indeed, I worked with a bunch of gentlemen engineering company folks starting in about 1990, where we built a software corporation, and it was involved with doing simulation modeling. And with it, we started off in MS-DOS, that was a nightmare, and then we converted it to Windows, and then we built a complete business around it, and we were working with big consulting firms around the world, and we were reorganizing corporations and making them more efficient and effective. But the simulation modeling has awfully similar kind of attributes to that which we can use AI. And this is why this is so interesting.
That is so exciting. So that predictive analytics, and then combining that now, we can combine that with Gen AI, which we can talk to in a moment. And what I really want to do is also share, we'll go back and revisit your experience with software and all of that, because I think that really ties really well into PACE. So tell me, this wasn't just a policymaker. You're not just a policymaker. You actually created something to me that has heart, has connection, has social impact, and it's called. Tell us all about PACE.
Well, I have to go back a little further because you make comments about not just policy. I frankly know very little about policy. I'm purely a pragmatist. I started off as an engineer and decided it was too linear, and then I became an accountant. And subsequently, after working for a bunch of years, and one of the corporations was Nortel, I left there and I set up a consulting business, and that was when I got into simulation modeling and redesigning corporations. And it was all about pragmatism. It was, they say in theory everything is practical, but in practice it's not. And so I don't have an academic bone in my body, zero. I have no policy views. I tend to look at things and ask simple questions like, okay, so how is this possible? How will we make it better? And what can we do to improve the world? And that was how I got to be here. So getting to PACE, actually I have to be careful about the term PACE Canada because there are about 2 or 3 corporations called that. The corporation we have created is called Program of All-Inclusive Care for the Elderly, and that is called PACE in the United States as an acronym. We've now incorporated a new not-for-profit called Program of All-Inclusive Care for the Elderly, in brackets, PACE Canada. And that way we can use the acronym legally, but it has to be in the right format.
Can I jump in here?
Sure, please do.
Because I wanted to just ask you a little bit more about PACE, but it really came from also a personal experience. So a son really caring for his mother and going through that health journey, which I've experienced in a different context and what brought us together. But I would really appreciate, because the people can really resonate and understand your experience navigating that health system and with your mom.
And it does come back to mom. My mother was around the age of 85. She was in good health. And she was living by herself, not in isolation, because my sister and I were present as often as she wanted, and perhaps more often than she wanted. And she was working for the Red Cross. But gradually her health began to deteriorate. And then she started saying things like, the young man in the condominium above me is drilling holes in the ceiling and he's shining lights at me, which we thought, well, that's a bit weird because we don't see any holes. And so we were thinking, well, there's no point in talking to a family doctor because clearly this is not to do with the body. It's got to do with the mind. So foolishly, we thought, well, we'll go to a gerontologist. And not realizing the gerontologist was not about the mind either. But we took her to a gerontologist, and the gerontologist said, well, she's got, she's a schizophrenic. And she's imagining things. And so she gave her some pills. And I'm sure they were the same pills that the gerontologist would give to somebody in long-term care who was acting up. Oh. The net effect was my mum was catatonic within 2 days.
That's awful.
And it took us 6 months with her sister, who was a nurse coming from Britain, to help. But she never achieved the same level of health and wellness that she had in the past. Oh my goodness.
That's okay. This is very real.
This is very real.
This is technology.
Well, this is the problem of being an elected official. There's always somebody wanting to talk, which is not a problem. It's a good thing. Yeah. But the consequence of that was Mom started on a serious decline, and eventually we moved her out of her condominium. My sister happened to have an apartment in her house, and it happened to be in Bellefontaine. Mom moved in, and she could not cope. And it was difficult for my sister and her husband. So one day we offered my mom the opportunity to go on vacation to a retirement home in Orangeville. And so she said, sure. She went up there, spent a weekend there. And we asked her, how was that? And she said, I loved it there. And we said, would you like to go back? She said, yes. So Mom moved. And that was fine. But retirement homes are not built for people who are becoming unwell. They are limited resources. Their costs are cut to the bone, and as long as you're in relatively good health and able to get around, you're okay. But Mum was deteriorating, and on an Earth Day, probably when she was 90, the lights went back on after being off for an hour, and somebody, presumably a staff member, approached her and said, "Are you all right, Margaret?" And my mother said, I'm all right, leave me alone, and apparently pushed this lady away.
Your mom is a little person. I don't think she could have done any real damage.
She was a lot smaller than me. Yeah. And she was clearly weaker by then. But that was deemed an act of violence. She pushed the lady, and that was deemed, Mum was frail. But I've heard from other people that, so my mum was just holding a glass of ice cubes and tossed it at the person. That was deemed an act of violence. Next thing we know is we're being told by the CCAC at the time, she has to go into long-term care and she has to go into a locked ward.
A locked ward?
A locked ward where we have younger people who did have mental problems that were not appropriate for the mixture of other residents in the room, and that was a nightmare.
Oh my God.
Anyway, so it dragged on for years. We got her moved out of the locked ward into a stroke ward where she was more comfortable. But then, if you get pneumonia in long-term care and you can't swallow the pills, there are no injections for antibiotics, and so you end up dying from starvation and malnutrition.
They should be giving. That's so strange.
Yeah, sorry, starvation and dehydration.
That's awful.
It's awful.
That's not even humane. You wouldn't even do that to your.
You wouldn't do that to your pet.
Dog or pet. Yeah, exactly. So that's what's so disturbing to me is that these are the, citizens, the people, our loved ones who've helped build a community and they've given back, and then we forget about them, or we mistreat them in homes that can't care for them properly. And also, if they don't end up in long-term, which my experience now, it's many years later, my mom, we couldn't get her into long-term care. There was such a long wait, but maybe that was for the best because I didn't understand what long-term care really is, what the environment is like. But we had a lot of navigation problems, just navigating the health system, getting proper health care in the home. But, really, just palliative care is a different conversation, but nobody should be not given injections for simple things like antibiotics. That's quality of life, and that's just basic humanity. Like, I don't understand that. That's awful.
It's a fascinating question. Clearly, the POA should have been consulted, and MAID would have been a much more reasonable solution. My mother's life was, of course, by that time, relatively sedentary, to say the least.
Yeah, well, she was forced upon, maybe, because, in an environment like that, you're also tuning to the environment, you're adapting.
Gosh, yes.
And so I used to, as a young person, I used to work in a very upscale retirement home. That was the other thing I was going to mention about the cost of that. But, I would see someone healthy coming in, and then they would decline so fast.
2 weeks.
Yeah. And this, it's just really because they're attuning to the environment and they're depressed. And even in a nice retirement, which they're paying nowadays anywhere from probably $7,000 to $30,000 a month, depending on where you go.
And what's wrong with you? Whether you need what support services you need.
Yeah, what support services can even be on top of that. So if someone does outlive, which is the next point I guess I want to say, which I want to talk about, keeping people at home as long as possible with the ecosystem of support, but it drains their life savings, and they might outlive those savings. So, and then what? And I actually, as a young person, I witnessed a very vibrant older lady go into a very high-end retirement home, because I was a PSW and I was like very young, but I was doing all of that. And then I saw her decline very quickly, but she outlived her savings, and then she ended up in a government-run long-term, which then she declined. And I happened to be close to the family, so I would visit her. And it was just a very sad story. And I don't think anybody is aware. They're not prepared for this. So tell me more about how PACE is programmed for all-inclusive care for the elderly, and the mission, and then how this can really support not only, obviously the elderly or the senior in the situation, but also the caregiver.
Well, let's start off with recognizing that our healthcare system is about the body. It ignores entirely the social determinants of health, which are to do with the psychology, the spirit, and the soul, and the mind. So all of those things have to be dealt with for somebody to be happy. The classic journey to make somebody's life from being relatively vibrant to much less is that they lose their driver's license. But you have so many other emotional factors that can influence a death of a loved one. The stories, horrifying stories. A colleague of mine's wife passed a few months ago, and her daughter, 15 years earlier, had been killed in a car accident, and her life was. She was devastated, poor lady, and then she was there for another 15 years. But her quality of life was decimated, and she was so upset. But there are all these things that happen, and then on top of that, people debilitated by sickness and so many other things.
And there's so many. I mean, often when you go into some of these care, long term or even the hospital or wherever, you maybe catch something or you fall, or all of these things can happen. But I feel the health system in general, I mean, we've talked about this before, it's not preventative, it's more reactive versus responsive. What's your take on this, and how could PACE change that?
Well, to pick up on that, the healthcare system is entirely reactive. People feel there's something going on. What is the first thing they do? Is they think, okay, maybe I need to go and see the doctor, but I don't really want to do that. So they will look on the internet.
Dr. Google.
I wasn't going to say that.
Or Dr. ChatGPT, whatever one.
Or whatever it is. And they will get a whole lot of information that may not actually be any help to them at all, because they're making assumptions. So they go and see the doctor, but by the time they get to the doctor, it's already manifested, and the journey has already begun. And I want to pick up on your comments about money. So what I find often is I'm talking to somebody who's older, whose spouse, for example, has become unwell and has had to go into a retirement home or care. And the fee has been $7,000 to $10,000 a month, typically for a room, and support, and then on top of that another $1,000 a month if you need medicine care and some other things, and PSW care, and if you need care all the time because you're bedridden, you're talking now $13,000 to $14,000 a month. Whereas if you get to that point where the spouse now is money's being taken out against the mortgage, and the next thing you know is then the partner dies, the spouse is left with nothing, has to sell the home, needs to go into hospital themselves, finds themselves on the top floor of the hospital, the alternative level of care, where basically the hospital doesn't want them there, the government doesn't want them there, and they're just trying to get them anywhere. And often there is nowhere to go. So today we have 70,000 long-term care beds in Ontario, and we have a waiting list of 50,000. In Ottawa, there is a waiting list of 10 years for long-term care. That is a death list.
That is terrible. That's exactly what it is, a death list. And if anybody's in bad shape, they're not going to make it to 10 years. And not to mention when you're talking about the spouse, so that situation is very sad. So they run out of their savings. Right. And now when it's, their stage of life, that next phase for them, they're living in poverty. And they may not even have support systems depending if they have children. And some children, it just all depends on the family dynamic. So, but also if I recall, I remember there was a stat, I think it's $90 million that would be saved with per 100,000 people.
Sure.
In Ontario, I think this is a stat. I'm not sure if it's Ontario or Canada, but if you can reflect or just
it's Ontario,
share.
But
yes.
let me so I'll get to that in a moment, if I might, to explain what Program of All-Inclusive Care for the Elderly is.
Yes.
So it starts off that Program of All-Inclusive Care for the Elderly, or PACE, began in San Francisco in Chinatown in a wellness service that was helping older Chinese residents in Chinatown who didn't speak English, but who were subject to a healthcare system that was fragmented, disconnected, siloed, and did not understand the language or the culture of the Chinese. And so this organization was called OnLock. And the OnLock service station support area, the word OnLock stands for happy and peaceful home.
I love that. And it's also got a double meaning, unlock in English, if you spell it with a UN versus ON. Yeah. Have you ever thought about that?
I have not. We have to think about that.
Yeah.
And so that out of that, they said, okay, what we want to do is have an integrated collaborative care model looks after the mind, the body, and the soul. And that they designed a system that had something called an interdisciplinary team, which has about 11 people on there, of which only one is primary care.
Wow.
The other people are dietitians, social workers, maybe PSWs, but all the people they need to support them. And then there's another person called a home care coordinator. And the home care coordinator works with a number of individuals. We call the people involved with PACE participants, not patients. And what they do is they work to deliver happiness and healthiness to the individual participant directly, but under the guidance of the interdisciplinary team. And so what you get is an integrated collaborative support mechanism where that person is getting everything they need to support what they believe is in their interests. And so that became the premise, the philosophy adopted by Program of All-Inclusive Care for the Elderly, or known in the United States as PACE. There is a U.S. National PACE Association. They have 86,000 people as participants, 186 service stations across the country. Of those 86,000 participants today, all of them multiple morbidities, all of them nursing care eligible, funded by Medicare and Medicaid. 97% of them live in their own homes.
And that's really an amazing stat.
And another one, 70% of them die in their own homes.
With support.
With support. So it's all about the support system to keep people happy and healthy at home. We have no doubt that it works in the United States. Contrast this to the more typical retirement home and long-term care, where they are incarcerated in the long-term care.
That's really the word incarcerated. That's very visceral to me. Yeah.
Right?
Yeah.
But what we know is that people want to be in their homes and they want to be healthy. And you think about it that way. If they're in their own home, they're not spending $7,000 to $10,000 a month in rent.
Which is insane. And then it's a lot more than that if you add a lot of the care on top. So you're saving so much money. You're saving the Ontario health system, the Canadian health care system, but also you're creating a happier, like we talk about living well, right? The quality of life, but also about the quality of the next phase, which when we exit, we want to becoming, I think it should be the same, right? It should be the same quality. We don't think of it that way because we don't want to think about death, I suppose, or then I guess people don't like using even that word, but to me it's, the next phase. And I think it's so important. You mentioned all the community and the ecosystem.
Right.
And I think that's so important. I started thinking about tribes. Like when you think about, I started going on a tangent here, but Indigenous, they had a tribe raising children. They had a tribe raising and also supporting their elderly. Like it's really about creating community for the best interest of everyone. Right.
Well, so to pick up on that point, the notion of the PACE story is in order to keep people happy and healthy at home, you provide the services to them in their home. So there's a little bit of cost. It's funded by Medicare and Medicaid in the United States, which is called capitated funding. No such thing exists in Ontario. What we do is we pay for people a bit when you go into hospital, when you go into a long-term care. But fundamentally, it's not intended to give you a place where you feel comfortable, where you're surrounded by loved ones. But if we could keep people at home, rather than pay $7,000 to $10,000 a month plus service cost, then how about they just pay the service cost, and that reduces their outlay by $7,000 to $10,000 a month, and then preserves their wealth, and then preserves their ability to live a happier, longer life. And when you get somebody going into hospital, they're already in crisis. Mm-hmm. Exactly. And so our healthcare system, which is so costly, is designed around fighting crises. You go to an emergency department, you got a whole bunch of people with a cut on their finger. They are not in crisis, but the only path they have is to go to the emergency department in the hospital. We are spending so much money by keeping people happy and healthy, preventative care in their own home. The cost of healthcare would diminish by $90 million a year per 100,000. And on top of that, would get $200 to $300 million a year of economic leverage.
And that's amazing on so many levels. So if the government can save all that money, they can reinvest that into other programs, right? Whatever those may be. But also the preventative thing is really interesting. I'm just going to now, because AI is sort of the lens I always talk about. So what's also interesting is how technology is being woven into this. Can you talk a little bit about this, the technology, and maybe we'll talk about the AI as well and how that can be incorporated?
Absolutely. Today, the only way you get help is going to see a human being, if you can get in time. And you know about people going to the emergency department and having to wait 8, 10, 20 hours.
Sometimes even pass away in the waiting room.
Yeah, and I didn't want to be the one to say that, but there are certainly experiences along those lines, and it is completely correct, but not satisfactory.
No, it's not.
And so if you want to go to your doctor, well, you have to make an appointment, or you go and wait for hours in the clinic, at the any day clinic. And then if you're lucky, you get to see the doctor. If you're lucky, you can
have a doctor. That's the thing,
right?
Too.
But what does the doctor do? The doctor gives you a prescription or a referral. Mm-hmm. So the referral can take you months.
Exactly, and then it's too late sometimes.
And then it's too late quite often. But that's the care, and that's the very nature of the reactive care model. But if we could actually push all of that back into the home and begin to work with individuals very earlier in the stages, at the low acuity stages, when they first appear. Most people don't have that option because they have to go and see a doctor. But actually with AI and with computing technology and telecommunications, when there is a question that somebody has about, well, what happened to my knee? What could the options be? What they do is that they go online and they will go to one of the sources of medical help, of which there are many, and of which there are not necessarily even remotely relative to the issue the person's looking at. But instead, if we can get past all that, get away from going to the human being, waiting till we can get into the doctor, we can have an AI system that is able to do an empathetic discussion. So I'm an elected official, and I get people occasionally call me up and they're yelling at me about something. And what I know is that I need to talk to them. They need to talk to me, because what they're yelling at me about is not what's bothering them. So when you go to the doctor says, "What's up?" Right? And they do a stethoscope on your chest and they do some tests and they go, "Oh, well, it's this," or it could be that. So we'll do this prescription and we'll send you to a referral. If we were to do an empathetic interview and the conversation would be, "How are you doing? What's going on in your life? And are you getting lots of exercise? And how's your family?" And gradually, what we know we can do that. You just listen to ChatGPT,
yes.
in the voice interaction. It's so phenomenal.
It's getting better and better.
Right?
Whether it scares you or not, it's a reality. And in fact, I feel it can be a great support system for some.
So if you start off with that in mind, we have the ability to have a conversation with a participant, and actually during the course of the conversation, fill out a whole list of questions without ever asking them that question, any one of those questions. It will evolve. And out of that, we can say, okay, so the system will kind of triage, but not that sophisticated, but will help us then get them to the human beings who are actually experts and able to get them to what they want. So for an example of this, we're working with a couple of towers, rental towers, and it's full of older adults. And we know there's a lot of people in those units where they are isolated, they don't have interaction, or they're bored, or they love something. So my mother, for example, loved classical music.
Wow.
Wouldn't join anything.
That's a love of mine as well.
Right? So she would love you, because the minute she met somebody who loved classical music, she would immediately embrace them and want them to be her friend. So everybody is different. You can't do a whole lot of progress and that's perfect. So you go into some of these condominiums, they have a social committee. Yes. And if you don't want to do what they're doing, guess what? Too bad.
You're left out.
And they will block you from having anything else. But if we can go straight to them with AI, and we can have a conversation, and we find out that they love playing chess.
That's wonderful.
We can connect them with playing chess online with other people.
And that's great, because that's social connection. That's also using their cognitive skills. It's really keeping them active and giving them some purpose too, to be honest. Yeah. And I think we all need some engagement. Obviously, we all have interests and passions, and they don't leave just because we become, a little older, 50 plus. So I think that is so interesting in the ecosystem, that not only that you're talking about the health, the actual health of the body, but you're talking about the mind.
Right.
And I'm going to go back and backtrack a little bit so people can maybe understand pace, like with the ecosystem that you're developing, like you mentioned the social aspect here, but you're developing an ecosystem. From my personal experience as, helping support my mom's health journey, and any caregiver that's, engaged in that, whether you're a full-time caregiver or in some support system, one of the biggest challenges is just navigating where to go, how to talk to people. And if you don't have a social worker, which they usually give you in the beginning, but then you're on your own after your mom comes home, or your whoever it is that's in your life. So it's confusing, it's overwhelming. And I won't go too much into the sandwich generation, but definitely, as most women, we somehow become that. We have children, we have aging parents. And then if you're, on your own, you're just trying to navigate. It's very overwhelming. Mm-hmm. In fact, it's one of the biggest stresses, like, how do I deal with this? And you don't have all the information. But if you have a hub, a tribe, an ecosystem where, you can go to this, and they're trusted, support systems like PSWs, social workers, support systems, whatever those are, or if you're looking for a place that they can live with support at home, all of these systems in place where you have a trusted hub. To me, that is what I understand at PACE, and I've recently joined. So I'm very excited to navigate and support this system. But tell me more about this ecosystem, because that to me is the solution. Right.
So central to what we are planning to do is to build a virtual PACE center. And the doorway to the virtual PACE center will be AI interaction from the get-go. So we will know that somebody is interested, they have something they want to talk about. We don't necessarily know that it's what they think it is. It could be something else. So we have this empathetic interview, and that allows us to help them, talk about whatever's going on. and then what they might need. And from that, we can connect them to every service provider. So we already have about 55 corporations, including people who have nurses at home, PSWs, caregivers, home cleaners. We have a company that works with people who suffer from anxiety and depression. We have people who long to go to bingo. So we can cover the waterfront of all of the social determinants of health, so keep them happy and healthy, because we don't need a doctor to get them there. But in addition to that, we will work with the healthcare system, and we have actually a company that has doctors who can work remotely to individuals who are not connected to a family doctor.
This is really important for rural areas, actually. So a lot of people don't think about it because we live in a city, we live in Burlington, and we're used to that sort of environment, that infrastructure. But if you're living in somewhere remote, especially if you don't even have a loved one nearby because you are in a rural area, or even if you are having a caregiver that is at home, you're still disconnected. So tell me how this can really support rural as well.
Well, so you go online, you make the contact, you get the phone call, or it could be online, and that doctor can prescribe you whatever you might need. But in addition to that, because you're working in PACE Canada with an entire environment of resources, then we can also work with you to get other things. So, for example, the technology largely does not exist in Canada, but through Program of All-Inclusive Care for the Elderly in the United States, there is masses of mechanisms by which you can work with an individual. So they actually don't need to go to a doctor. For example, we have one device about the size of my hand that has radar in it. And the radar system is monitoring vital signs and movement and things like that. And you've got devices that connect automatically with an adult diaper to see whether you're toileting properly.
This is key.
It's all there, and they have 200 items. There is software to support that, supported by AI. We have more software that works to support the interdisciplinary team as well as the care coordinator. We have software that we actually can build entire community support mechanisms around them, so people linked into the individual or groups of people. So we already know that in communities we have software that has never been deployed in Ontario. Essentially, we have equipment that can be deployed to help people to monitor somebody who is frail. But rather than find they've fallen down and they're down on the ground for 18 hours, we would know instantly.
Yeah, and that's so important, like the IoT, Internet of Things, but then you combine that with, the analytics of predictive AI, even if you had, just like these are wearables, but also these can be, detectors in your health, or in your home. So predicting your health as well. So for example, if it can somehow observe, which I'm sure it does, if someone's unstable or feeling, and then you combine that with the analytics of maybe their actual health system, and then maybe voice as well, you can predict that they might need some help sooner than later. So I would, preventative care, someone's intervening with that before it gets serious. Because, for example, if someone falls, which is when I would say a lot of seniors' health really declines after a serious fall, is like when they break a hip or anything like that. It's obviously the physical part, but it's also a lot of the mental health part. So I think this is so radical and transformative that we can do something like this with people that live in disconnected communities like rural, or also just even at home here, because you can be so disconnected within even a city, right? But if you're combining that, and then if you're having, I say living environments, communities, where you have a group of people living together, that's even more ideal. But having all that infrastructure of AI, the predictive analytics, really just those analytics, combine that with a Gen AI, and then even potentially agents, which are autonomous, where you can really see where gaps are and prevent things before they're happening or before they get serious, or even predicting. My mom had something called chordoma, which is really it's 1 in a million. It's very rare. It's a spinal form of cancer, but it could have been diagnosed so much sooner. Sure. And just I'm teaching with U of T. There was a discussion at Rotman this morning about, just taking a selfie that this app can now, it's not necessarily about cancer, but it can determine maybe potentials for skin cancer or your mental health. It can give you some updates on really maybe there's some flags that you might want to address now. These are just simple things, but this can be much more transformative as well, like especially with cancer diagnosis, if you can catch things early. I mean, this is huge.
If I might pick up on that, one of the devices that our groups have is a pillbox that is connected, and so if somebody fails to take their medication, the system will know.
Oh wow!
Or if perhaps the television is not switched on one evening, then there would be knowledge. Central to the application of the technology is the very notion of monitor, predict, and avoid.
That is interesting, because even the simple things like you just mentioned, the television turned off, or maybe they didn't go into the kitchen for 24 to 48 hours. Obviously, there's a lifestyle change or a mobility change,
sure,
or even a mental health change. So then that can be addressed way before, and people aren't suffering alone.
And the technology cost is so much cheaper. But imagine that it doesn't require somebody to take somebody to the hospital. All it requires is for somebody to say, we need to deal with this now. And prevent. So it's definitely monitor, predict, prevent, and it's all available today. The challenge we face is that the healthcare system has been underwater for many years prior to my mother becoming unwell. But when my mother became unwell, there was capacity in the hospital, in a doctor, in a long-term care facility. Today, there is none.
None. Yes, exactly.
And the problem with that is that the aging population is increasing at the rate of 3.5% over the age of 75 every year. And we know that in the next 20 years, it's going to about double. And we know it'll peak in about 2050. And the government cannot put enough money into the reactive care system, cannot. There's no value in building long-term cares, but there's terribly great value in creating a preventative care model, keeping people happy and healthy at home, letting people die in the home, but make sure they're comfortable. That reduces dramatically the cost for the preventative care, not for preventive care, for the reactive care system, takes the pressure on the healthcare system because the doctors aren't coping well, and allows folks to live in the community and reduce the cost massively.
I totally agree with you, because it's obviously the baby boomer generation is, going into that next stage of life and it needs support. But also I want to add on to the caregivers, because I've experienced that and many, many people have or are currently. And so something like PACE alleviates that stress as well, and anxiety, knowing that there is a support system, there is something that can help them, and also retain some savings if they're needed later too, because there's some certain circumstances where they do maybe need even more care than being at home. But at the end of the day, it's really keeping them, I think, that quality of life. And so how do you see AI in the next stage of, like, say, healthcare? What would be your perspective on that? You're seeing it with IoT and predictive. Do you see it in any other way moving forward, how it can really transform, say, let's just with PACE?
I believe we can provide early intervention without the help of the reactive care system, and connect people into a predictive, preventative care environment, and therefore, by early intervention with low acuity issues, cause those not to become critical.
Yeah, I think that's so true. It's like, makes me think of Star Trek, where, what was it, Scotty? What does he say? Anyway, something's going on with the ship and it's always critical, right? But if they had just maybe been a little smarter with their predictive analytics, that something was coming. So I think that's so important, though. I mean, everything in Star Trek to me is coming true. That's why I mentioned it. But, anything from, like, the the cell phone is exactly a good an analogy, and the iPad, for example, but also Google Translate, and all these things are coming true, and even the holodeck, like, let's face it. So, but we could even create environments, like, there's so much potential for good. And I know there's a lot of fear surrounding AI, and there's some legitimacy, obviously, with governing, I will say even with healthcare, like the data. So I don't know, can you speak to that?
I can. The information that we will be collecting is not controlled data. It's lifestyle. It's not going to a medical record system, an EMR or an EHR. It's not that kind of information. It's simply descriptive information that allows us to build a relationship with the individual and to help them. There will be collection. There will be a need to collect information, and that will be collected, and that will go through all the appropriate systems into the EMR and the EHR. So we're not stressed about that. But frankly, this is information that's available today. I mean, even if you go on ChatGPT, Health, they're asking, well, there's a whole bunch of stuff, but it's typical ChatGPT, which is, well, we'll give you some answers. Great. That doesn't actually solve the problem. The benefit we have with agent AI is that we can cut through it all, and we can assess it, and we can connect people early into the system that will get them the care they need and help them live a happier and healthier life.
I so agree. I think those granular, I would say, data points connect to a much macro overview and the potential for so much good. And obviously, PACE is it is HIPAA compliant. So all that data is secure, because a lot of people do get worried about that. But at the end of the day, too, you want to be able to use that data to help you, your life, your longevity, your quality of life, and also for your caregivers in your life. So I think there's so much benefit for good, and it just has to be governed. And I think that's the important part, and guardrails up.
Yeah, and I wanted to just pick up on something. My comments about the healthcare may seem critical. Frankly, being a Canadian, I deeply appreciate our universal healthcare system because it's an insurance policy and it gives us confidence. Other countries, you don't have to look very far. You've got lots of people who cannot afford it, cannot get it. So I'm deeply appreciative of our healthcare. I am concerned about its state.
Yes.
And it's the fact that it was designed in a time where you could build that and pay for it. But those days are no longer viable. So my view of the healthcare system is, and you were asking me about that and I didn't fully answer it, is that we will work with the healthcare system. We know it needs to be redesigned, but it will be in a way that is kind and gentle to the healthcare system so that it can adapt to an environment where they can help keep people happy and healthy at home. And
I love that.
They will change.
And I know you're probably going to repeat some of these words that we've discussed throughout that. If you had 3 words to describe what PACE is, what would they be?
Happy, healthy home.
Amazing. That would have been so amazing for so many people. My mom did have the privilege of being at home as long as possible, but did not have the ecosystem to support her. So, but now it's a personal mission of mine. So that's why I'm very much on board with PACE. But on a final note, I did want to ask AI. What 3 words would you describe AI as? Connect
people healthily.
Oh, I love that too. Healthily. Is that a word?
I just made it up.
That's great. Why not? There could be new words in AI. But connect. What was the second one again?
People.
Healthily. I like that. Healthily. I'm going to start using that.
This is the way I get into one word.
Yeah, healthily. I like that. That's a new word. I think you should use it for PACE. And so, Councillor Paul Sharman, how can people connect with you?
Well, at the moment, it's really simple. You just send an email to paul@paulsharman.ca.
Wonderful. Well, thank you so much, Paul, for joining us on this conversation at the Kristina Shea Show. But it's really about bringing communities together, leaders together, and innovators together so we can talk about how we can make AI, where AI meets ambition and impact. And I think this is a really incredible example of such. So good luck with PACE, and I'm very, very proud and honored to be part of that initiative as well. And I look forward to what's coming next, and we'll have you back on again.
Well, I'm delighted that I had this opportunity to spend time with you. I'm more delighted that we are colleagues in this journey, and I'm looking forward to coming back with updates because this thing is moving the speed of a rocket.
Yes, we'll see how it all goes. And it's going to be an amazing ride, I think. And I can't wait to see what happens next. Pace. We're going to be moving at the pace of momentum.
So the new website is going to be called At Your Pace.
At your pace. That's perfect because everybody's at a different phase of life, of different pace. They're all at different stages. So, I think that's for everybody at any point in life, whether they're retiring or whether they are young, to be honest. And actually, I'm just going to ask, I don't know if this is too early to say, but you had an interesting acronym with PACE, was a Program for All-Inclusive Care for the Elderly, but you had put something in my mind for at a later point. Can we share that?
Oh, we can, because as we evolve this, we're taking the path of least resistance. The critical issue is the elderly.
Absolutely,
right now.
I agree.
But we know that once we've established this program, it will be in effect for everyone. So we're thinking we'll change the name from Program of All-Inclusive Care for the Elderly to Program of All-Inclusive Care for Everyone.
And I love that. And it's also very equitable, really. It's, thinking in a broader picture and bringing the tribes, the communities together. And thank you, Paul, for everything that you do and this initiative that you've started. It's going to be an amazing success. I already know that. And it's going to change so many lives. And that's where really, I think, ambition meets impact. And that's where AI intersects. So thank you again, Paul Sharman.
Thank you very much.
Thanks for joining me on the Kristina Shea Show. AI, Ambition and Impact, powered by Women Up. If today's episode helped you think bigger, scale smarter, or see new possibilities for your business, make sure to subscribe. Share it with a leader. Share it with a friend who needs it. And connect with me at KristinaShea.ai for in-person workshops, corporate training, and Women Up leadership experiences. You'll find everything there. Until next time, keep building with intention, leveraging AI strategically, and turning ambition into real-world impact. Let's power up together and build what's next. I look forward to connecting with you. If this sparked something in you, don't ignore it. The future isn't something we wait for. It's something we step into. Thank you for being here, for being part of the conversation, and for choosing to lead in what comes next. This is the Kristina Shea Show, AI meets ambition and impact, powered by Women Up. I'll see you next time.